Fighting the spread of HIV, doctors and advocates around the world are making progress containing the virus. But in China last year, the country's central health authority says there were 104,000 new infections. That's up nearly 15% from 2013. Surprisingly, officials say infections among elderly people are on the rise. China still ranks far below most other countries for HIV/AIDS infections per capita. According to a recent report from the country's Ministry of Health, there are about 780,000 people living with HIV in China. Discrimination against them was banned a decade ago. Still, some are struggling to find their place in society. CCTV's Peng has insight.
Living with HIV. This is the first time Xiaodong has agreed to speak on camera, though he's asked us to change his name. He contracted the disease from having unprotected sex while doing methamphetamine drugs. Since then, he had to come in for testing every 3 months at this HIV medical center in Tianjin.
When I first took meth, I felt so stimulated and couldn't control myself. My mind became empty, and I had delusions. It triggered a strong desire for sex.
Xiaodong is just one of the HIV carriers in China, 80% of whom became infected through unprotected sex. In addition to many health challenges, patients must also often cope with social discrimination. Professor Zhang Linqi had spent decades studying the social integration of HIV carriers in both China and the United States. He said so far in China, misconceptions about the disease are still a major cause of the prejudice against patients.
Some people think that by casual contact, such as shaking hands, sharing dinners, and then hugging or sharing a swimming pool, could easily transmit. So all those unnecessary fear really pose a lot of pressure on HIV-infected patients.
In an attempt to erase such misinformation and teach people how to prevent the disease, a growing number of NGOs in China are introducing basic courses about HIV in schools and communities. There are an estimated 1,000 NGOs in China now devoted to HIV prevention and awareness.
With courses like this, Chinese people will begin to realize that while HIV/AIDS is incurable, it is preventable by maintaining a clean lifestyle. But that causes another moral dilemma. Now people might not just see HIV carriers as victims that need understanding, but as ones with a stigma of having led an indulgent or, for some, unethical lifestyle.
Professor Zhang said that China can learn from the United States to cope with the new situation.
Over the last 10 years, there's great progress made in the U.S., largely because of the public announcement activities.
Xiaodong says he's afraid that if his identity is revealed, he may lose everything, from his job and income to his social status, all because of a bad decision years ago.
I regret it so much. I can't help thinking all the time, why did I take drugs and have unprotected sex? I hope young people will not repeat my mistake and will cherish their lives.
Xiaodong is still learning to cope with his new life carrying the virus. While he may never be cured of the disease, he hopes that he will live to see a society that's more aware and tolerant. Han Peng, CCTV, Beijing.